I'm Mike Scott. I'm from Roanoke Rapids, North Carolina.
My name is Glenda Norris, and I live in Tarboro, North Carolina.
Well, the main problem I was having was for the past several years, I had lost a lot of teeth. So I was having a problem eating, and the teeth that I had weren't really very functional, to be honest. Before I had the implants, I was really limited, very limited in what I could actually eat. Pretty well limited to soft foods or easily chewable foods. And also, I guess one of the things in my business that affected me as much as anything was just the aesthetics of my smile, the way I was very self-conscious of the way I looked and and so when I smiled, it was with a closed mouth or I covered my mouth or those types of things. And so it was not just from a dietary standpoint and a food consumption standpoint, it was actually the way I felt about myself.
I couldn't keep my teeth in. They were always floating around and all. It's not like your top ones, they stick in. Your bottom ones just lay there. Mm-hmm. And I've had no teeth for years, so I had just a bone there, I guess. But anyway, they just floated around and all that kind of stuff. I'd had my bottom teeth relined several times. They just did not fit good. Mm-hmm. And with these implants, it's the best thing I've ever done. My bottom teeth were very loose. Like I said, the top teeth, they stick in there, but the bottom teeth just lay there. And over the period of time, years, I think it just deteriorated, my bone did. So it was very, very loose. I don't care how many times you had them relined, they were always very loose. A lot of money on polygrip trying to eat. Like I said, before I'd eat, I put it on there, and after I eat, I had to put some more polygrip on it just to get them to lay there. Mm-hmm. Do they just float all around?
I was having problems with my regular teeth. I had partials at the top, but I had just a few teeth at the bottom that were my own teeth. And the dentist had been trying to keep my teeth up for me. They were getting real brittle. And I did everything in my power to keep my real teeth. Spent a lot of money.
And so I'd been doing a lot of research on various solutions and on what might be the best for me for a long-term solution. And I made an appointment here and came in and met with Dr. Jernigan, and he spent, all the time that I wanted, actually, and presented several different alternatives. And over a period, actually, of several months, we finally decided that the dental implants was the best solution for me.
Well, I've been here several times and had my teeth relined and all, and I saw the advertisement about the implants, and I thought about it, and then I said, maybe I can get me some of those at hip, because I had highly invested in polygrip, because every time I would eat or anything, I had to put polygrip on my teeth to eat. And then before I ate and after I ate. So like I said, I highly invested in polygrip. Now I don't have to worry about it at all. And then like I said, when I read that advertisement, I said I should check into that. And then I did check into it. And I said, maybe I can do that. So I decided to get it done, and the best thing I've ever done.
Finally, when I decided, let me look into this. So I did some research and was searching online for different alternatives. And the dentist I had in Greenville, he could do what Dr. Jernigan, but not all in one day. Like he couldn't put some teeth in my mouth right then. So I was like, no, I know there's a better way than this. So in my research, I came across Dr. Jernigan's. I called the office and made an appointment, came over here, my husband and I, to talk to him about it. And from day one, they were just as courteous. He sit back there, he showed us a film. He explained things to me, what the process is. And the bottom line was, before we left the office, just go home and think about it and then come back and let me know.
Well, and since that time, since I had the implants installed, it's just been a world of difference. My self-esteem is skyrocketed. I can eat anything now that I want. In fact, one of the negative parts is I've gained 10 pounds since I finally got my final teeth in and so forth. But nonetheless, it's been a life-altering experience for me. Well, I feel like the biggest benefit that I have achieved is just getting back to normal. The ability to eat, the ability to speak clearly, the ability to feel confident about the way I looked and my smile, and so I think there's a lot to be said for normal. And I think I finally, after quite a long time, was back to that point in my life where I felt like I was normal again.
All kinds, because I can eat now what I want to eat. My teeth just feel like normal, really. Feel like normal teeth there.
So
Exactly. My teeth don't move around or they clamp right in. I don't even know that they're there. I mean, as far as clamped in, they just there now, just like my real teeth were.
Yes, my confidence. If you've been for a long while with your teeth going bad and missing or anything like that, once you get this, and especially the implants, because I had heard enough about the bottom ones floating around, people talking about float. So I knew that I wanted these implants. And because of that, and I wouldn't trade it for anything in this world. My confidence, my smile, my persona, my talking to anyone. I mean, I can just get up there. I teach Sunday school on Sunday mornings, and I can stand in front of that class with so much confidence and so much power. I just feel great. I mean, I feel great. That's
awesome.
the biggest benefit that I have received from my dental implants is my confidence, and my smile is back.
Well, I guess the thing I was worried about the most was I wasn't worried about the procedures. I really wasn't worried about the going through the process. I guess I was worried about the end result, and would it really be what I was looking for? Would I really be able to get back to a normal eating and again the smile and the way I looked and so forth. And so, and I really wasn't worried about it, but the more I've researched and read and the more talking to Dr. Jernigan here and the staff, it just made me more and more comfortable that this was the right decision.
And like this gentleman said before me earlier today, the finances we had to take into consideration. But right then and there, my husband said, I don't see any alternative to this. Let's do it. So right there the first day, my confidence was in this young man. And I said, let's go for it. Let's do it before I have time to change my mind and get home and think about it and everything. And so that was day one.
Well, my experience here was just incredible. I mean, from day one, I walked in, nobody knew me. I didn't know anyone here. I didn't really have even a regular dentist back in Roanoke Rapids. And instantly, it may sound cliche, but I really felt like family. And when Dr. Jernigan spent that time just going through detail of the various solutions and alternatives and so forth, and the follow-up and reminders and so forth. I mean, it was just that part was probably, that was the pleasant experience aside from the final implants and the final result.
Yeah, my experience here was very wonderful. Everybody I met was just like family. And I'd just come in and didn't hardly have to wait any at all. They'd see me every time I came, and whatever I needed, they would do it. Wonderful. Every time I ever came here for anything, just to look at it, make sure everything was okay, everybody was just wonderful. Very nice.
The experience was wonderful. Each step of the way, the staff was professional, kind, wonderful, and like I've already heard, their family, they truly seem like they are. And both Dr. Jernikins were just phenomenal, just phenomenal. I am so pleased that I had this done. Everything was phenomenal. It was a wonderful experience. I was nervous, apprehensive. They walked me, baby-stepped me each step of the way into the process. So the whole process in itself, I knew what I was expecting to feel that night when I went home after the surgery had been done, but what led up to all of it that first day and right on up and to the follow-up. They called me the next day, concerned, seeing how I was. So it was from day one to it was a year. Was phenomenal, was great.
I would highly recommend dental implant treatment. It's a big decision for folks. It was a big decision for me and my wife. It was a financial decision that we both worked on together and to come up with a solution on our end. But if it is financially achievable, I would 100% recommend dental implants.
I highly recommend it. Highly recommend it. Get that, and even anybody who needs just one tooth to go in, it's got a partial plate or something like that, I told them they need to have these implants done. I would highly recommend these implants to anybody, like even partial plates or whatever, 1 or 2 teeth here. Get these implants. They're the best thing you'll ever do.
Yes, I would, and I have already done it. Everywhere I go, with anybody that needs it, I have told them about it and highly recommend it. Yes, absolutely.
That's excellent to hear.
It's awesome. They are awesome.